We are now joined by infectious disease specialist Dr. Zain Chagla for his weekly visit and update on COVID-19 and the vaccines. Welcome, nice to see you.
Hi, good morning.
All right, so this week Moderna has asked Health Canada to authorize a booster shot of its COVID-19 vaccine. Should people who have had Moderna be concerned about this booster?
No, I mean, this goes with a pattern of very vulnerable individuals needing a booster. So those with immunosuppression, those with extremes of age, particularly those in long-term care facilities, where we're already vaccinating some of those individuals. So this is more the administrative part of getting those vaccines in, letting them be approved to the typical pathway so that, that this type of process can be done kind of more on-label as compared to off-label.
Now, remember there were some concerns months ago when we were starting to vaccinate younger kids under the age of 18, when there were some countries in the world where adults hadn't even had their first shot yet. Now, with these boosters all coming in, how does this affect developing countries?
Yeah, obviously there is still a large gap. The World Health Organization expected 40% of every country to be vaccinated by the end of the year. There are going to be a significant number of countries, particularly all of them in sub-Saharan Africa, that will miss that target, right? So, I think we have to take this on balance. Yes, I think boosters are probably going to be something that are going to be needed at some point. But, it really is upon us to make sure that we get first and second doses into people that do need them first, knowing that our current vaccines still have significant protection, both from getting COVID-19, but also for being hospitalized and dying.
Now, let's talk about the mixed vaccination situation here. There are a lot of concerns. I was talking to someone the other day who had their AstraZeneca and then went and got an mRNA vaccine. They usually work across the border in the U.S., but they can't cross right now. So anyone with a mixed vaccine can't cross the border. Do we see some resolve coming here with this?
Yeah, and this is an administrative hurdle altogether. This is not related to efficacy whatsoever. It's administrative. And again, this is pressure from the Public Health Agency and the federal government to push the World Health Organization and other countries to accept this vaccine series, like many in Europe also received once the AstraZeneca issue started happening. The issue is us as Canadians have done the same thing. There are people that are fully immunized with Sinovac and Sinopharm, which are the vaccines produced in China, that are effective, that are approved by the World Health Organization, but we refuse to accept too. So there still needs to be this international benchmark, which many countries have not used. And again, the victims are people like travelers who then have to navigate the system while they've been effectively vaccinated and done the right thing.
Absolutely. And speaking of travel, so Prime Minister Trudeau just announced that not only will federal public servants have to be vaccinated, but so will people who travel on federally regulated transportation like via rail or taking flights even in Canada, right? So how big of an impact is that going to have?
Yeah, I mean, again, these are rules that are being applied to settings that are not essential, but also, higher risk for transmission. And again, as we live with this virus, we have to keep settings safe. Right now, a vaccine is probably the safest thing for preventing transmission more than anything else. Yes, masks and distancing work really well, but vaccines work all the time. So, I think these are reasonable moves moving forward. We do have to be a little bit careful as we get to things like public transit, how much essential, stuff we need to keep for everyone rather than just vaccinated people. But, I think these are reasonable moves. And again, hopefully it improves uptake in people that are, willing to travel very in the near term future.
I agree. So one last quick question. Safety this weekend. We're allowed to gather according to Dr. Kieran Moore, but any little quick tips for people?
Yeah, fully vaccinated people, masks down, fine. Keep gathering small. If you have a mix between unvaccinated people, particularly vulnerable unvaccinated people, so adults and people with medical conditions, consider doing it outside or consider doing it virtually. But, again, it's not the year to discourage gatherings. It's just keeping them small and then keeping them relatively short.
Right, because we all want to gather and feel happy again and feel loved around our friends and family. Thank you so much, Dr. Zain Chagla, infectious disease specialist. Thank you so much for coming on the show. We'll see you again.
No problem.